Um, that's one thing. But to repair the gut, we have several mechanisms. One I mentioned before is a hydrochloric acid, betaine, a stimulant of the normal bowel fluids that should be there. It also, has an independent antitoxic effect. Then there is substances like slippery elm, mucopolysaccharides that coat the gut and heal it. Then there is the bowel scrub agents like psyllium husks and
binders of
husks of grains and vegetables that sort of scrape the surface of the bowel like sandpaper and take with it worm eggs and infectious agents and so forth. But that's all. The Metamucil is the sort of the prototype of that, but there is probably a lot better products out on the market. This is sort of the more normal bowel healing stuff, and stuff.
Digestive enzymes, I haven't heard you mention.
Digestive enzymes, we're getting to that issue.
Okay.
Yeah. But my principal simple test in the beginning of all that is, the question is the gut an issue or not? The easiest way is to look at the stool of the child. And first of all, the stool should be one piece. It should have a fairly large circumference. It should be shiny and smooth on the outside surface. It should be coated flawlessly in mucus. And it should
be brown.
It should be brown. Or when you take a lot of chlorella, green is acceptable. Okay. And it should take one wipe with toilet paper to clean the rear.
And there should be no chunks.
There should be no chunks, no parts, no breaking apart. There should be nothing moving in there that you see, and so forth.
And it should sink in the toilet.
And when it falls in water, a healthy stool sinks. And a healthy stool stinks very little. If a stool stinks, this is the undigested fats. If a stool floats, it's the lipids, the fats in the stool that are undigested that make it lighter than water and make it float. And so when a stool stinks or floats, we know that the pancreas is not creating enough lipase, or that the gallbladder is not squirting in enough bile into the gut to make it work. Now, one of the older treatments for autism is the injection of secretine, or the transdermal application of secretine. Secretine is a peptide created in the small intestine that stimulates the pancreas for making more enzymes and stimulating the gallbladder for making more bile. Now, I think it's a fairly elegant treatment. It has worked for a few kids.
It's expensive.
Not for too many, but it is forbiddingly expensive. We had another peptide that was around for a while, cholecystokinin, which is the specific peptide that stimulates the bile to squirt in for the fat digestion. But let's kind of roll back diagnostically. My 0-cent diagnostic test, whether the pancreas or the bile is a problem, to smell the poop and to look if it floats or if it sinks. If it sinks and doesn't smell, these are not the important issues you need to address right now with this child. You have 50 other things to attend to already. Don't waste your time with that. But if it floats or stinks or breaks apart, or you need a lot of layers of toilet paper to wipe off the bump, you need more paper the more fat is in the stool, because that smears it like cream all over the place and you can't really get it off. And
when there's chunks of the food they ate in there, that's certainly not a sign of digestion.
If you see undigested food, now this is just relating to the fats.
Okay.
Yeah? Now, when visually you see large chunks of undigested food in there, in a stool that sinks, you know it's not the lipase from the pancreas and it's not the bile that's the problem. Yeah? But it's probably either the other enzymes or it is the lack of hydrochloric acid. And my simple way is, if you see chunks, give betaine hydrochloric acid. That stimulates all the bowel processes. And then whether the stool sinks or floats or stinks or doesn't stink or need more than one toilet paper or not, you start with the betaine hydrochloric acid. because it turns on all the processes. And you
Okay.
see whether it ends you up in 3-4 weeks.
Okay.
Yeah. And the way that should be taken is, like you said, 1 capsule 10 minutes before you eat, 10-15 minutes before you eat, you get everything going. 1 capsule immediately before you eat, and then depending on the size of the meal, 1 or 2 extra capsules during the meal.
Oh,
That
okay.
would be a full program.
Okay.
So I think that part we can sort of leave there, but it's.
But with the enzymes, you're not a fan?
Well,
Because they're all mold
here-
derived. My son never likes them.
Yeah, yeah. No, here's my thing with enzymes. Enzymes are very much a symptomatic treatment. As you do for the body what the body should be doing.
Right?
And so giving hydrochloric acid to stimulate the body to make its own enzyme is a more foundational principle. And then of course going beyond that, you could use acupuncture to make the body make its own hydrochloric acid to do that, or use the tapping techniques and mental field therapy to make the body do it all on its own. Yeah, but the hydrochloric acid is one step more towards the basics. That's one reason against enzymes. The other reason against enzymes is that most of the enzymes now are made by bioengineering, by making Aspergillus, a toxic fungus, training it to produce enzymes, pooping out enzymes basically, and those are the enzymes. And what they are a mix of enzymes with some residues of Aspergillus contaminants. And since most of the kids are allergic to Aspergillus, they don't tolerate the so-called plant-derived enzymes. They're not plant-derived, they're mold-derived.
Except for Wobenzyme.
Yeah.
And what about pancreatin?
No, and pancreatin and other animal-derived, the other enzymes are animal-derived.
Okay.
Yeah, that means they're direct dried-up secretions of the pancreas of the pig or of the cow, and they come with the risk of mad cow disease. There's one company that clearly makes the best enzymes in the U.S. It's called Transformation. There's Nest Enzymes and Transformation. They're both the leading companies,
Okay.
and they make very good ones. But I know enzymes have helped a lot of kids. There's also enzymes specifically to digest gluten and dairy in kids that just cannot come off it because they refuse to eat anything else. I do recommend to use those, but this is really like a very, very superficial patch.
Right. But what about the enzymes like Wobenzyme that are designed to gobble up inflammation?
Anti-inflammatory
Yeah.
enzymes.
That'd be a better anti-inflammatory choice than
Yeah.
most of the other stuff
Yeah,
out there.
yeah. Well, we have several American products like Vitalzyme X,
Margozyme or
yeah, Inflammazyme,
Wobenzyme?
or the company in San Diego, American Biologics, makes a good anti-inflammatory enzyme. I do think there's nothing that Wobenzyme has that we can get in America at a lesser price.
There, you can or cannot.
No, there's better American products
okay.
for a lesser price.
And none of those are mold derived, correct?
No, not the ones that
The ones
I'm
for
aware of.
inflammation.
Yeah.
Okay.
However, there's the animal origin, so it's an uneasy area for me to talk about because symptomatically a lot of the kids improve dramatically when you put them on enzymes. But the moment you stop the enzymes, they're back exactly where they were before.
Right.
It's not having a deeply healing effect. Now, the anti-inflammatory enzymes we give for 2 reasons. One, that some processes of inflammation in the brain can be slowed down with high doses of enzymes. The second one is, I think we talked about the fibrin layer yesterday.
Right.
Inside the blood vessels when there's chronic infections like Lyme disease. The blood vessels are lined with fibrin and fibrin precursors, and the oxygen exchange from the red blood cells to the tissue is impaired. And by giving high doses of enzyme, it loosens up that fibrin net, and the oxygen travels easier into the tissue, and it's a great advantage in terms of feeding the tissue with oxygen and fluids and nutrients. And so the high dose anti-inflammatory enzymes are a very good temporary solution for the kids while we're doing the detox up here and trying to get the primary things under control, it's a very good symptomatic treatment for a lot of the kids to get them symptomatically better.
I saw it as being sort of a way to get some of these agents designed to detox sort of in deeper where they need to be. It's sort of what
The electrolyte solution
will do that.
is much better, much cheaper, a more elegant solution. And the enzymes, we were hoping to be some sort of drug delivery system. It hasn't really dished out to be that. Yeah, it was disappointing in that way.
We didn't talk about this, but the concept of over-supplementation is something my naturopath brought to my attention a long time ago.
Mm-hmm.
And I explained it in the part that I wrote in the book, which is basically everything you put in your body that you don't successfully assimilate as being good for you requires energy and enzymes to detox and process out of your body.
Yeah.
And don't you find that most of the kids that you see come in on a real over-supplementation sort of regimen?
Yeah. So of course my approach to the children is on the first visit to take more things away than I give them. But
Like multiples, aren't those?
But let's put a little science to it. So
Okay.
one piece of science is that we know that when moms take vitamins during the pregnancy and then children are supplemented early on in their life, they have a far higher incidence of food allergies than children that never have seen a vitamin.
Interesting.
So there's already one indicator that it may be very real, this problem. And then
The vitamins companies love you right now.
and then
Wow.
secondly, when we look at any vitamin product, when you actually look at what you're getting, you get like 90% of it is
Filler and gel
fillers,
caps.
binders, the capsule itself, which is of animal origin, probably contaminated with mad cow prions, and 10% of what's actually in there may be the active ingredient. I do not understand that most of the things we take as vitamins do not need binders and fillers. It's just easier to
fill
get.
that.
It's just easier to get things in a big capsule than squeeze it in a small capsule. But most of the capsules that would be microscopically small for what the active ingredient is in it, and so it's a part of the industry I don't understand. And then if you then have a child that takes, if somebody takes 3 pills a day, that's one thing. But if you take 300 pills a day, and 90% of that is coloring agent and binders and fillers, and most of it used today, I would like to set it here on video. The most common fillers used are magnesium stearate, which is the same chalk that you use on the school board in school, the white thing that you draw with. That's what they fill the capsules with. Or the latest fad is titanium dioxide, which is a extremely allergenic toxic metal, which has been shown to, after a few years of using this, causes a severe increase in autoimmune diseases. So there is a downside to the way we're doing vitamins right now, and my hunch is that what really is building up is not the actually active ingredient, but it's the binders and fillers. It's just so much magnesium stearate, so much chalk that you can eat in a day without getting sick from it. And there's only so much titanium dioxide that you can take because it's a toxic metal that we put in the vitamins that are sold by reputable vitamin companies. It's unbelievable, And there was in the early days of Allergy Research as a company, so they prided themselves, sort of eliminating everything out of the capsule except the active ingredient. Now that philosophy has gone out the window many years ago, and they have the same stuff in there now that everybody else has. So there is a real problem with that. And then there is a problem with the active ingredient, that if you're overdosing a substance that only has a very small physiological range, that means the range between, like selenium, if you have too little selenium, you get cancer and immune deficiencies. If you have too much selenium, it's a toxic metal that's just as toxic as mercury, where you can die from. There's a narrow physiological range, and so